Welcome back to another episode of Dr. Ryder Shows Us Stuff. Today we are looking at the inferior view of the skull, and we're going to learn the landmarks as well as the foramen. So I'll give you a little mnemonic to help you go through the foramen that works both on the inferior view and the internal view of the skull. So here we have our occipital bone, and you notice in our occipital bone there's this quite large hole. This is foramen magnum, right? But we're not going to be concerned with that right now. What we're going to look at first are these little bumps right here and right here. Those are where our spine contacts our skull or our occiput, and they are called our occipital condyles. So when you nod yes, this is where all the action takes place. A couple other ones that we already know are the mastoid processes of the temporal bone, as well as the styloid processes. All right, so we're going to go back to our foramen magnum and to our occipital condyles. If you come to the anterior surface where they kind of meet here, you'll notice there's this slide. This slide of bone is called your basal occipital area. So basal occipital area. He's going to be our starting point for our foramen. So the mnemonic we use for our foramen is lots of spiders can jump high, call mom. Once again, that's lots of spiders can jump high, call mom. So we're going to use that to go through our foramen. This works, like I said, on the inferior view that we're looking at and also on the internal view. It works if you're going left or if you're going right. Okay? So our first one here is we're going to go back to that basal occipital and we're going to fall off the edge just lateral to it into that hole. That is our lots. And we have of spiders can, and I'm going to tip it here so you can see these next two. This big hole here, that's jump. And then if I turn it just a little bit more, you can see this hole right there. That is our high. Then call mom. So we can do that on the other side for you as well. Lots of spiders can jump high, call mom. All right, now let's go through their actual names. Our lots is foramen lacerum. Then our of is foramen ovale. Spiders is foramen spinosum. We also refer to this one as spiny tiny because it is tiny and it is right next to the spine here. Then you have your carotid canal for can. The big one back here is your jugular foramen. I also like to refer to it as the giant is jugular. This one here, oh, my probe doesn't want to go through, is hypoglossal or the hypoglossal canal. Then you have condyloid, and then you have foramen magnum. Right? So we'll do that on the same side on the other side here. Foramen lacerum, foramen ovale, foramen spinosum, carotid canal, jugular, hypoglossal canal, condyloid foramen, foramen magnum. And this concludes this side of the skull.